since the pandemic, the number of healthcare workers have dropped, and many hospitals in the U.S. are in dire need of team members. Today, OCH Medical Center held a job fair to look for their next employee. Our Takia Cummings went to Starkville today to talk to longtime healthcare workers about the importance of staff members. She joins us in the studio with more. Takia.
After COVID, many employers lost a lot of employees, and now businesses like OCH Medical Center are having to take care of more patients with less people on their staff. I talked to the healthcare workers at OCH Medical Center today, and they explained how important it is to have more people working beside them. It's been 2.5 years since the beginning of the COVID-19 pandemic, and it has taken a toll on the workforce in various ways. One of the areas that was hardest hit was the people who were taking care of the patients. Healthcare workers, especially nurses, left the job behind for various reasons, including burnout from high patient loads and long hours. Many haven't come back, and some hospitals are still short-staffed. At OCH Regional Medical Center in Starkville, they're taking matters into their own hands, holding a job expo to recruit new members to the team. Chief Nursing Officer Gloria Boyd says patients haven't quit coming, but there are fewer patients to look after them.
Since the pandemic in 2020, we're receiving more patients who are very sick and they're requiring more care. The nurse-patient ratios have gone up around the world.
More people in the office equals better care. That's why Boyd says she is working hard to increase the number of nurses.
And we're trying to keep our nurse-patient ratio to a low 6-to-1 or less than that. As we hire nurses in, then we feel like our nurses will be able to do better care to our patients and the outcomes will be better.
Director of Respiratory Therapy, Wes Andrews, says events like this help them find the right employees.
I think it's important to let the public know the opportunities that we as an organization have that can help them professionally and to grow in a level, really just to practice the art of caring for a larger group of patients.
Andrews adds that not only are you gaining knowledge, but you are also caring for people in the community.
What we focus on here, at least in our departments, is growing the profession. Okay, we really want a quality professional who wants to focus on caring for patients again. It's the personal touch that comes to the bedside. It's the difference you make when you look in the patient's eyes, and you really get to see the fact that what we're doing, it makes a difference.
OCH plans to hold another job fair before the end of the year.